Okay, good morning. Welcome everybody, and thank you for joining us today for the Caribbean African Health Network Health Hour on hypertension, the silent killer explained. So, my name is Dr. Onyi Okonkwo, Dr. Onyi Okonkwo, let's say it fully. I'm a GP partner in Birmingham. I am also one of the trustees of the Royal College of General Practitioners. And like I said, I'm down in Birmingham. I live in Birmingham, but I'm currently in sunny London. And it will be wonderful to hear where everyone's tuning in from, because I understand this is a very popular session and we have people that join us nationally, internationally. So it would be wonderful if you could put in the chat where you're joining us from, so that at least we know who is in the audience this morning. I think wherever you're joining us from, as long as it's sunny, don't forget two things. Keep hydrated and use your sunscreen. Yes, we need sunscreen, and make sure that you use something that is above factor 30. So today we have a fantastic treat for you. Backed by popular demand, Dr. Ayo Olatoye has come back to continue the conversation he started 4 months ago on hypertension, which is high blood pressure, the silent killer. If you haven't seen that session 4 months ago, I promise you it is well worth watching, because I've done that. It's on our YouTube channel and it was really, really interesting. Who is Dr. Ayo? I am sure most of you that join this channel every Saturday know who he is. He is a consultant in acute medicine. He's a transformational mindset coach. He's the founder of Master Builder, and he's a long-standing volunteer. I've watched some sessions where he is on the seat like me as the host, and he is absolutely brilliant. He is passionate about empowering our people so that we can build resilience, overcome mental barriers, and achieve our full potential. So without further ado, I am going to hand over to the fabulous Dr. Ayo, and we will hear what he has to say again about high blood pressure. Thank you, Dr. Ayo.
Thank you so much, Dr. Onyi, for that wonderful. I was looking around and saying, who's he talking about? Again, I'm very grateful to be invited. Thank you for everybody for joining live, and those who are watching on YouTube or whichever streaming platform. So who's in the chat? We've got some people from Birmingham, we've got Bristol, Manchester, Salford, Manchester. So yeah, thank you for joining. We're going to have a great time. This is going to be a rehashing and a continuation of the conversation we had previously about hypertension. So I'm going to share my screen, and then we can, but please let me know if you can see my screen. Wonderful. So I was just saying to everybody, I'm going to have to get a new profile picture because I don't look like that anymore. There's a lot more salt in the pepper. So again, thank you. Why do I always say thank you? So first off, I'm grateful for the opportunity to have the conversation. I think it's important. I'm thankful for Khan to provide this platform, because we know what it's like to be in a health service and for people maybe not to appreciate our sensibilities, our issues, and our questions. So for Khan to provide a platform where we have people who look like us to have the conversation, well done, Khan. I want to thank you for listening. I think it's important. We have to start taking better care of each other, and I think rather than looking around to say, what can they do for me? We need to start doing it and own it. So thank you for taking care of yourself. It's really, really important. Right, okay, so who am I? I always say I'm many things. So I'm a Christian, I'm a father, I'm a husband, I'm a brother, so this is my wife, that's my beautiful children. In case you're wondering, butter would melt. I am a son. This is my parents. I'm a PK. My parents are pastors. I'm an author. I'm lots of things. Why is it important? Because I think all of these things impact our health, who we are, how we show up in the world. And I want to, I'll come on to that in a minute, but just to talk about what we're talking about today, we're going to understand the impact of hypertension on health. and we're going to talk about some things that may not cost any money, but potentially evidence-based lifestyle interventions to managing hypertension. Say it with me. Prevention is better than cure. Say it with me. Prevention is better than cure. As a doctor, as an acute medicine consultant, I see people who are in an emergency all the time, you know, and I think modern medicine is fantastic for emergency. And I think there's a growing body of evidence that's called lifestyle medicine that avoiding the emergency is preferable. Wouldn't it be better if we could live our lives in such a way that we didn't ever have to go to hospital as an emergency because we knew how to maintain good health? That's a really important message. This is, I think, to bolster that point on the 2 slides before, I believe that I am a spirit, I have a soul, and I live in a body. And I think this is really important when it comes to the concept of health. Have you ever wondered when you're feeling sick, you've got an infection, you don't feel like, let's say, praying or going to church, or when you're spiritually energized, you're able to physically do more? Why? Because we're related. We are all of these things. And when it comes to health, there was a ancient French-speaking society, and their understanding of the word health was when body, soul, and spirit was aligned and balanced, and they called that a state of ease. Okay? Now, when it was not balanced, we were in a state of dis-ease. That's where the word disease comes from. And I think it's important for us to take a step back and look at the word health and not just think my body, but also think my body, my mind, my spirit. Because, and I think I love the fact that Khan allows us to have this conversation, because I think all of these things pertain to what true health is. Obviously, today we're talking about hypertension or high blood pressure, but I wanted to introduce that concept so we can start thinking about that as we move forward in our lives. Okay, so God's original idea. What do I mean by that? I am fascinated by this concept as it pertains to body, soul, and health, because I think there are so many things that we have done as a society that have moved us away from God's original idea. So many things we've done in the name of moving forward or convenience or advancements and stuff, and they move us away from a state that our bodies were designed to operate optimally. Let me give you 2 examples. You need cold and dark to sleep well. And that was great before we had electricity and central heating. But now we have central heating and electricity. One of the things that we sometimes do is have lights in our room and we have the heating on, not realizing that these things, although they make our lives more comfortable, if misused, can contribute to us having poor sleep, and do that over a period of time, that will affect your blood pressure. So think about all the things that we do to make our lives easier, or in the concept of technological advancements. How many of those things, sitting for a long time, you know, and not walking, being indoors rather than being in sunlight, all of those things may be moving you away from what your body needs to be healthy. Something to think about. Okay, so what is blood pressure? Because we say a lot of things in society and we don't necessarily understand what we mean. What I want you to think about is a garden hose. It's sunny now, you're outside, and maybe you're spraying your flowers, or you're spraying your kids if they misbehave. I want you to think about opening the tap. When you open the tap, the water rushes through the garden hose. Before that, it was flat, and now the garden hose is filled. because there's a pressure that's been exerted on the walls of the garden hose. So think about blood pressure like that. Blood pressure is the pressure that has been exerted by the blood in the blood vessels, and it comes in two stages because the heart pumps and then relaxes. It pumps and then it relaxes, which is why when we talk about blood pressure, we talk about two values. The top one, systolic, that just means pumping, and the bottom one, diastolic, that means relaxing. Okay, that's what we mean by what blood pressure is. Now, so we talk about this normal. What's normal? So it's measured like that, 120/80. As you're young and normal, that's what we're aiming for. When we contract a blood pressure of 120 millimeters of mercury, that's what NMHG means. And when it's relaxed, 80. There's still a pressure when the heart is relaxed. That's why the value is not 0. Okay, so hypertension. This is a really important point. It's something that's new compared to the thing that we talked about the presentation 4 months ago. Hypertension is an umbrella myriad of problems that all result in a higher number, but can be mediated or caused by lots of different things. So cardiac output, what do I mean? Think about it like you're pumping up a bike tire or a car tire with a foot pump, and you have to press, 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 press. Every time the heart pumps, there's a certain amount of pressure that goes out, and that's what we mean by cardiac output. Yeah. Vascular resistance. That is just a way of talking about how narrow the blood vessels are that the blood has to go through. Blood volume, how much water and specifically salt is retained in the body. Kidney regulation, how the kidney is involved in so many things, but the kidneys are involved in the control of salt, fluid, and hormones, specifically hormones that pertain to blood pressure. And nervous system, stress, and all these kinds of things. So, for instance, we know about the fight or flight and sometimes freeze response. When there's a threat, your body focuses, it narrows what it's looking at, and it gives you a fight or flight or freeze response. But what it accompanies that is high blood pressure, fast heart rate, and wider pupils, so you can focus and do what you need to do. Now, why is that important? Because if you are in a state of chronic stress, so there's no actual threat, your blood pressure will be high as a consequence of that. Why is it important to talk about all of these things? Because it helps us understand why one treatment for blood pressure, or high blood pressure rather, might work for one person, but might not work for another person. Or why some people need a combination of things to get their blood pressure where it needs to be. Okay. Again, what's normal? There are, as far as we're concerned, so normal blood pressure, normal tendency, what we call it, is 120/80, and there's a range. But we as doctors start to get concerned in anybody if their blood pressure is 140/90 when we check it in a clinical setting. That's stage 1, hypertension. Hypertension is just a fancy name for high blood pressure. And stage 2 hypertension is 160/100. Now, we know that when you come to see a doctor, you know, you're so excited to be there that your blood pressure tends to be higher than if you were checking it in a different setting. So if you were to do an average home reading, if you have a blood pressure monitor at home, which I advise everyone to get, or we did a 24-hour monitor, the values are slightly lower because we know that quite a lot of people have a higher blood pressure when it's measured by somebody in healthcare. That's normal. It's important for you. One of the things I try to always say is informed is armed. So you want to know what is your normal blood pressure. And as a doctor, I would advise that rather than an individual reading, more importantly is the trend. So when you come and see me with high blood pressure, yes, it might be high, it may be low, but what I'm most interested in, what has it been like every day for the last week. That's really important because your blood pressure fluctuates in the day anyway. So we try not to make decisions about medication and other interventions based on one reading. We try not to do that. Okay. Now, why is this this is calm. We're talking about Black people, African and Caribbean. Why is it important? It's so interesting because sometimes we use the term Black or Afro-Caribbean and we're not necessarily sure about what we're talking about. But I thought it was useful to be careful because what is Black? You know, there are some people who think Black is you have to listen to Afro beats and eat jollof. That, you know, there are some people who are Black and they don't do any of those things. So what do we mean? We know that from a biological point of view, African and Caribbean people have a salt sensitivity. So our bodies retain salt at a higher level than our white brothers and sisters. Renin is a hormone that's involved in blood pressure regulation, and our levels are different than other people, which is why some medications work better for us and some medications don't work as well. Kidney sodium and family history. So these are other biological issues when it comes to the Black community or African and Caribbean. But sometimes there are things that we say Black, but it's more an environmental thing. And you know that when we look at American conversations, they tend to use the word Black synonymously with low socioeconomic groups. And I don't necessarily agree with that, but we have to address that because in some of these places, access to what real food is like and our habits in terms of what we are eating. We know that, for instance, people who live in lower socioeconomic housing tend to have higher blood pressure, and it can be multifactorial, lots of different things. Shift work, people who have to work nights, so that kind of stuff. We know that working nights in general is not good for your blood pressure. Where you live determines the cars and what's going on and the air pollution, and it matters because these things impact our body. Opportunities for safe exercises. There are some places that you can go to the park and you can go to the field, you can run around and it's fine. And there are some places where you live where people wouldn't advise that. So these things have an impact. Now, again, none of these are reasons, in my opinion. These are facts that we have to find a way. If I am in one of these classes, okay, my question to myself is, well, how do I overcome that? Because it's my life and I still want to be well in 10 years' time. So how do I overcome these issues? Okay. Okay, lived experience. Now, one of the things that we have to deal with is this is something that other people don't have to deal with, our white brothers and sisters. Racism and discrimination. Back to the point I made about stress. The fact that we have to navigate the world in the Western environment, which was set up for people who maybe don't look like us and don't have our culture, means that there is a level of stress that we're dealing with that is higher. There's data to suggest that. And all of these things contribute to an activation of this fight, flight, freeze system, which again, over time, will cause your blood pressure to be higher than it would otherwise have been. These things, you know, we have to talk about them. They're relevant. And anybody who says they're not an issue maybe isn't living the same life that we're living. They're very real issues. Okay, so now we're going to talk about what kinds of things that we call risk factors. As doctors, these are things that are contributing to potentially you ending up having a diagnosis of hypertension. What I think is important for you to remember is there's a phrase that somebody said, sorry, there are things that are non-modifiable. So these are things that you just are and you cannot change. Okay, these increase your risk and you can alter these things. So how old you are, no matter what your papers say, you are how old you are. If you know, you know. And your family history, is it in your family? You know, where you come from. Men tend to develop high blood pressure earlier But obviously after menopause, women's risk catches up on certain inherited kidney conditions. You either have these things or you don't have these things. And these things contribute to a higher risk of you ending up with high blood pressure. Now, there are some what we call modifiable risk factors. So these are things you absolutely can do something about. Being overweight. There were some times in our cultures where, you know, being overweight was called good life, but it was from a place of scarcity and lack. So because historically we may not have had availability of food sources, and especially meat, when we came across them at higher levels, you know, and we started to put on weight, it was evidence this person is rich, this person was doing well. Now we have to understand for clarity, this is not fat shaming. You are a valuable human being no matter what your shape. We have to just acknowledge that being overweight is an independent risk factor for a lot of medical conditions, and high blood pressure is one of them. Too much salt, being sedentary, and like I said before, lots of things in our life, the jobs that we do, the way that we relax, are putting us in a situation where we're probably not moving as much as we used to. And some people don't like the word exercise because it can feel like a high ideal. I just say move more, you know, whether it's, and I'll talk about that later, too much alcohol, you know, and again, these things increase your blood pressure. Smoking, we talked about vascular resistance before. Smoking increases vascular resistance, and poor diet. These are what we call modifiable risk factors that you can do something about. Addressing these things over a period of time can cause your blood pressure to reduce. I think we have some other modifiable risk factors. Oh yeah, so chronic medical conditions, diabetes, kidney problems, obstructive sleep apnea, which I'll go on to talk about soon, high cholesterol, thyroid disease, primary aldosteronism. That's just a hormone problem that can cause you to have high blood pressure, and Cushing syndrome is also a hormone problem because of the problem with your adrenals. All of these things can contribute to high blood pressure. So if you recognize yourself with all of these things, this is not the time to panic and say, oh my goodness, no, what is me? This is to say, okay, now I know where the fight is. Yeah? Okay. So obstructive sleep apnea. Why is it important to talk about that specifically? Obstructive sleep apnea happens in people who tend to be overweight in their midriff. What happens is these people, overnight, they stop breathing momentarily. Now, their oxygen levels fall when they do that, understandably, and your body is a machine. It's designed to react to these things. When your oxygen level falls, it is a reflex that your stress hormones rise because your body needs to do something. Your blood pressure rises as a consequence of that, and obviously it causes your heart to work harder. So people who are overweight, people who snore, and if you are with somebody who snores and occasionally stops breathing and comes back, it's worth Googling what's called an Epworth sleepiness score, or going to your GP and saying, can we have a conversation about this? If you find yourself overweight and being very tired in the day, go to your GP and say, can we have a conversation about obstructive sleep apnea? Okay, poor sleep. To me, sleep is a superpower. We know that sleeping less than 6 hours consistently is associated with high blood pressure, obesity, and diabetes. And these things are like a vicious cycle. This hustle culture that we have here, or you've got the grind, it's a lie. It's a lie, it's a lie, it's a lie, it's a lie. Please, you are a less good version of yourself if you don't get a proper night's sleep. It's important for you to prioritize your sleep, please. People who don't sleep is when blood pressure naturally dips, and people who don't sleep properly have an averagely higher blood pressure over 24 hours. It's an issue. Okay. Now, all of these things are what we call an allostatic load. They're kind of ethereal things that can put in our life bucket, and when our bucket overflows, it can lead to high blood pressure. So, and you may wonder, social economic, how would that? Well, worrying about finances, experiencing racism. For a lot of us in our families, we don't engage with social service in the same way, so we take on caring responsibilities. Living in an unsafe area, again, poor sleep, work stress. As you get older, you start to experience bereavement. And although grief is a natural reaction, it has an impact on the body and difficulty accessing care, depending on where you live. All of these things are contributing to this bucket. And if the bucket gets filled, then what the ultimate end of it could be, I've been diagnosed with high blood pressure. There's a phrase I was talking about before. Somebody said, genetics load the gun, but lifestyle pulls the trigger. And so we've talked about these non-modifiable risk factors. This is who you are. You are a man, you are black, you are 50, all of these things, fine. You can't change anything about that. They may load the gun. You have a family history, fine. But lifestyle pulls the trigger. And the thing that I think is really important, and one of the things that I've really been impressed at the Town Health Hour, is the emphasis on putting responsibility back on you. This is your life. As a doctor, 100%, I want to see you during an emergency. Dr. Onyi wants to have conversations with people in the GP practice before it becomes an emergency. However, we both want everybody who's listening to this to understand this is your life. The responsibility for making sure that you are as well as you can be for as long as you can be is yours. Healthcare is here to support that. But I want you to take the reins and say, okay, how can I make my life more healthy? Okay. So why should we care? So to be fair, this is American data, but the themes are more important than the numbers. Significant numbers of Black people have high blood pressure above the national average. Black people in general are more likely to develop it. And we've talked about what the risks are in terms of problem. Why is high blood pressure called a silent killer? Because most people who have high blood pressure don't have symptoms. One of the problems I see almost weekly is somebody who had a diagnosis of high blood pressure, took medication, they said they felt better, so they stopped their medication maybe 5 years ago, 10 years ago, and then I am seeing them because they now have an emergency that maybe could have been avoided if they had taken their blood pressure over that time. So remember, how you feel in general is not related to your blood pressure. Most people, the vast majority of people who have a diagnosis of high blood pressure have no symptoms at all. So please don't judge your need for medication by symptoms. We know that stroke risk increases as blood pressure increases. Again, American data, but for every 20 millimeters of mercury of high blood pressure, there's a doubling of stroke risk. Target organ damage. So I want you to think about it. Your blood vessel like a garden hose. The blood is going all around your body, to your brain, to your kidneys, to your lungs, to your heart, to your muscles. Now, the blood, if a high blood pressure will cause structural damage to small blood vessels, which will eventually cause damage to the organs that they support. So one of the things that we look for as doctors is, how has the blood pressure affected organs? Is there any evidence of blood pressure damage to the eye? That's why when you go to the GP, they might look in the back of your eye. Is there any damage to the kidneys? That's why you might want to give us, we might give you a urine sample. Is there any damage to your heart? You might have an ECG. All of these things. Is there any damage to the brain? We know that high blood pressure increases the risk of things like dementia. And so there's something they call all-cause mortality. This is dying for any reason. High blood pressure is related to a higher risk of just dying. Now, I don't want you to be scared. I'm not saying dying by the end of this call. I'm just saying over a 5-year, 10-year, 20-year period, if you have untreated high blood pressure, it increases the risk. of death. Now, that's why you are on this call right now, because we are going to take this into our hands and do what we can to reduce the risk. That's why you're here. That's why you're going to pass this video to all of your friends so that they can have an understanding of it. Okay, we talked about this before. Yeah, so in terms of medication, there are different kinds of medications I'll come on to, but there are some that are more effective and less effective in Black people. ACE inhibitors, although for non-Black people under 50 would be the first line, in general, it's not a good idea. They're not as effective in Black people. And why is it important? Because everybody has the experience that they have. So we are learning now in terms of medicine and statistics and all of these kinds of things that some of the data that we have that was proof was studies done in middle-aged white men historically. So it doesn't necessarily reflect the population that we're dealing with today. So it's important that not disrespectfully, that maybe we challenge some of these things, that say you're a Black person in your 30s or 40s and you get given an ACE inhibitor. I think as a GP, your GP would be happy to have a conversation about the rationale to it. Just, you know, and it may be that you help them and bring information that they may not have otherwise have been aware of. I see Dr. Onyi nodding about that. One of the things that I believe that we've been talking about a lot on the Calm Health Hour is learning how to advocate for yourself. You don't have to be rude or bullish or arrogant, but sometimes you may have to say, okay, well, I've heard this or I've seen this. Can we have a conversation about it? Okay, so these in general are the medications that we give people who have high blood pressure. The diuretics, the purpose of them, again, I want you to remember all the things we talked about that contributes to high blood pressure. Diuretics reduce salt. Water goes where salt goes. So if you get rid of too much salt, then that reduces the water retention, that reduces the blood pressure. ACE inhibitors, they relax the blood vessels, and then it makes it easier for the blood to get through. It reduces the blood pressure and vascular resistance. Calcium channel blockers, same difference. Beta blockers, they slow the heart rate down. So again, same difference. And ARBs, they are essentially very similar to ACE inhibitors, but they have fewer side effects in general. So your GP will know all of these things. I think the lesson here is that there are certain circumstances with certain conditions like diabetes, for instance, that an ACE inhibitor might be first line, regardless of who you are. But other than that, if you're under 50, the GP gives you, just have a conversation. Say, can we talk about it? Okay. So I'm going to talk about this in more detail with my colleagues. Okay, fine. So go back. Complications of high blood pressure. There can be end-stage renal failure. That means your kidneys stop working, and as a consequence, you have to go on what we call renal replacement therapy or dialysis. And that can happen. And we know that people on dialysis complain a lot about a poor quality of life because they have to be there 3 times a week or do the peritoneal dialysis at home 4 or 5 times a week. There are some things that can contribute to a barrier to care. We talked about structural bias in healthcare. We know that if you, for a lot of conditions, if you track race and outcomes, people who are Black tend to be worse, and that's not to do with anything other than, you know, the system maybe being biased. And there's lots of work happening. We have to acknowledge that it's an issue. There's lots of stuff happening to address that. Mistrust, we were just talking about this before the call. We know that and we have evidences of things that have been done to people who look like us that calls us to be, let me just think about this. Cultural and language issues and some spiritual misunderstandings. As a Christian and a son of a pastor, I want to tell you that taking medication is not a lack of faith. And from my point of view, wherever the healing comes from, via whichever mechanism it's good that heals. Jesus had Luke as one of his disciples. Why would he do that if he was against medicine? It doesn't make any sense. He even allowed him to write one of his biographies, the Gospel. I think it's really important for us to be able to balance that. The Bible says, faith without works is death. So sometimes the thing you have to do is take medication and move forward. I will always argue, I believe in miracles, but I also believe that miracles can be proven. It's not about how I feel. So if God heals me from hypertension, there will be proof of that when I test. So what I'm saying is engage that conversation with your GP about coming off medication, because miracles, if God heals you, there will be proof, and your blood pressure will be consistently low over time. I'm conscious of the time. So let's go through this. We're going to rush through this because some of this we covered in the last video. Breathing exercises. One of the things, because society is grind, if you notice, you probably breathe shallow most of the time. Most of us don't sit down and take a deep breath. So there's a box breathing as an exercise. So let's just practice now. In for 4, hold for 4, out for 4, hold for 4. And doing that, this is great in the moment if you feel stressed, because it activates your vagus nerve, which activates your parasympathetic system and helps you to doing that over a period of time, or getting into the habit of deep breathing can help your blood pressure just stay where it needs to be rather than creeping up. Walking, it's free. 30 minutes a day, 5 times a week, a brisk walk, quick enough so that you can talk but maybe not sing, and consider walking in group exercises with group people. There are people I know who were given a diagnosis of hypertension. They did nothing other than regularly walk, and then over time their blood pressure has gradually come back to the normal range. Now obviously, if they stop doing that or they eat badly or whatever, that can go up again. But they've been able to manage it in a way that didn't have to take medication. What else do we have? Okay, yeah, so on average, after 3 to 6 months, you can have a drop of around these numbers. And again, please check and have that conversation with your GP, because this one may work for you, this one may not work for you. What else do we have? DASH, for dietary approaches to stop hypertension. So the emphasis is on fruits and vegetables and whole grains, lean protein, and low dietary fats. And there's some data to suggest that it can reduce your systolic blood pressure by 11 milligrams. So you could be in the hypertensive range, let's say 145, and then because of this, over a period of time, you check and your systolic can come to 144, and now you're out of the hypertension range. You know, this one may work for you. We've also got increased potassium. Now, we talk about sodium a lot, but having a higher level of potassium in your diet helps you get rid of sodium. So things like bananas, spinach, lentils, and salmon, and just, you know, have a look online as to, you know, what you can do. What that does is it helps your body get rid of excess sodium. And we know that lower sodium reduces your blood pressure. Dietary fiber. High dietary fiber is associated with reduced blood pressure, but it's back to this social economic thing we talked about before. When we're doing shift work and when we're grinding and all this kind of stuff, often we make excuses or we say it's so difficult to eat well. The problem is that, yes, it may help you in the moment, it satiates your hunger, but all these things over time, not having properly well-cooked meals, it's hurting you. So it's important for you to be, yes, it may be that you take more intention or whatever. Yes, you may have to meal prep and it may take time, but you're helping yourself, you're moving yourself into a much more healthy state. Sleep optimization. I can't stress this enough. Poor sleep and sleep apnea can raise your blood pressure significantly. And losing weight and having good sleep in the context of sleep apnea can help you reduce your blood pressure. So again, if you snore, if you wake up and you're tired, if you wake up with a headache, you have sweaty fingers, go and speak to your GP. Optimize your sleep. Sleep optimization is a whole talk in its own, so we can't talk about it today. Cold exposure. And again, with all of these things, please talk to your GP. Please talk to your GP. Cold exposure in some people, you might, I think if you're becoming an elder statesman or woman, maybe not think about this one, but what it does is over time, it activates your parasympathetic nervous system and reduces inflammation. But if you're young, you know, that cold showers and stuff after the gym, it reduces inflammation. But again, over time, it can reduce your blood pressure. So for me, what I do is in the shower, and when I need to wash the soap off, I turn the temperature off and do that with cold water. Let me be clear, I don't enjoy it. However, I am making decisions today because of who I want to be in 10 years' time, or the life I want to live in 10 years' time. I tell my friend, the journey to being a fit granddad starts today. It doesn't start when my kids get married. Fasting. It's so interesting. Again, God's original idea. I was having a conversation with my friend. There are so many people who now want to take spirituality out of life and whatever, but there are so many practices that are, you know, in the Bible that are good, and we thought they just had spiritual benefits. But there's lots of data that fasting has health benefits. Now, obviously, we're not doing it for that, but it's just useful to understand that, you know, God is so wonderful that, yes, fasting is done as a spiritual practice, but it does have physical benefits for your body. So it can reduce insulin resistance. Insulin resistance is something that causes people to put on weight and increases the risk of diabetes. It can also reduce blood pressure. There's lots of data, emerging data, that if you go on a 24-hour, 36-hour fast, what happens is your body goes into a state that's called autophagy. What it means is your immune cells look for things that are abnormal in your body to dissolve and eat. So it increases your body's fight against infection, and even with some data that says it increases your body's fight against things like abnormal cells like cancer. So look into it. And again, talk to your GP. Talk to your GP. I think there's two more connections. So laughter and social connection. I think this is really important. We were designed to live in societies and to be connected. And unfortunately, with all these social platforms and connections and friends and whatever, we're actually less connected than we've ever been. But again, God's original idea was for us to be connected. We're social beings. When you laugh and you have fun and you do something for yourself and you're there with your friends, it reduces your stress hormones and it boosts your nitric oxide production, which is something that relaxes your blood vessels, reduces vascular resistance, and again, reduces blood pressure. The Bible says a merry heart does the body good like medicine. Who knew? God knew. Okay, and the last one is music therapy. Whatever your preferred genre, classical, gospel, reggae, or anything, these things, again, they slow your heart rate down, they help you relax, they reduce your sympathetic tone, which is how strongly your blood vessels are contracting, how much your body is sensing, and reducing it reduces your blood pressure. And is the thing that can sometimes make you can go from feeling stress to not stress with an associated drop in blood pressure. So again, some of these things we talked about before, but I thought it was really important to go over again and maybe add some things. I always try and say, change one thing. It might be too much for you to do all of these things together, but change one thing and do that thing consistently. As a coach, one of the things I have noticed is that human beings, we value intensity over consistency. So if I told you that you could be healthy and all you had to do was a marathon once a year, you would prefer to do that than just put down that burger or put down that cake every day or walk more or reduce your salt. But unfortunately, in life, achieving your success, however you define success, is more likely going to be as a result of consistency over time rather than big things periodically. So my strong advice, watch this video, send it to your friends, watch it in your friends group, watch it with your families and say, okay, as a group, what one thing can we try for 6 months and measure your blood pressure every week and just see it change over time. So yeah, thank you.
Thank you.
I think after that, we're going to take some questions.
Oh, thank you, Dr. Ayo. That is absolutely brilliant. Even as a GP, I have learned so much from this session again. So absolutely, thank you for that. Yes, we have a few questions in the chat. And I think before we start the question and answer, I'm going to apologize to everyone because I think for this session, we're going to run slightly over. And for good reason, because there is a lot for our communities to learn from this. Like you said, we get high blood pressure earlier, we get complications from it. So it's good that we empower each other. And I love the fact that you said genetics knows the gun, but our lifestyle tends to fire the gun. So let's see what we can do about our lifestyle. So going to our questions, I know you've touched on some of this in your presentation, but I just want you to for us to be clear about them. The first one, it says, I already have blood pressure. Can it be cured, please?
So that is a great question. I think the answer is, in theory, yes. Now, it depends on lots of different factors, how high your blood pressure is, and again, what other risk factors that are there. Now, but is it possible to go from a state where you're taking medication for blood pressure and maybe modifying your lifestyle into a situation that your blood pressure reduces so you don't take medication? The answer is, in theory, yes. My caveat to that is that I think what's really important, especially for those of us, is that there is an unease about health issues. And some of us have an ideological problem with having a diagnosis. And therefore, there's a resistance to saying, almost like a confession sort of thing, oh, I have blood pressure, oh, God forbid, that, like, you know, rather than accept the fact that this may be a cross that you have to bear and manage in the best way possible. So, as I said before in the talk, absolutely it can, you can modify things, but if you end up in that position, you'll be able to test it. So in conjunction with your GP over a period of time, it's absolutely possible to change things and then not need medication, 100%. But don't just do it because you feel that you shouldn't take medications, and don't just do it because you feel different. Please discuss it with your GP.
Thank you so much for that. And I would echo that and say it's always good to have your own blood pressure machine where you can check for yourself. And if you've been diagnosed as having high blood pressure, I know somebody's asked us that question in the chat. When should the GP review your blood pressure medication? For my patients, I would invite you in every 6 months. And if you're that well controlled, I would invite you in every year so that we still check your blood pressure. We still check for those complications that Dr. Ayo mentioned. You do your heart tracing, do your urine and all that. And just keep an eye on you and just make sure that things are still going the way they should. So please, 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 if you can afford it, get a machine. The other question I have for you says, how can you be sure you're being given the right medication for your blood pressure as a Black person?
Yeah, that's a great question. So the first thing I want to say is that the majority, 99.99999999999% of everybody in healthcare is doing their absolute best. I want to reassure you of that, because I think that I want to make sure that the premise of this question isn't coming from a place of you people aren't even, no. The majority of people in healthcare are doing their absolute best. Now, just like we've said, in the context where you may be, I'm not sure this is the right thing for me, especially if it was an ACE inhibitor and you don't have a diagnosis of diabetes, just have the conversation. You know, there are reputable sources where you can do your own research. And, Dr. Onyi can attest, and I can attest. Sometimes a patient has come to me and said, I've seen this or whatever. And because we're human beings, we'll go away, we'll do our research, and we might come back to you and say, actually, you're right. So the first thing and like I say, is most people are doing their absolute best, but you have information now that maybe some other people don't have. So if you end up having an ACE inhibitor or other thing and you're not sure about it, just have the conversation. Now, for some people, to control their blood pressure may take more than one kind of intervention. That might be any of the lifestyle things we talked about or medication. I know some people who are on 3, 4, 5, different kinds of things that might control their blood pressure. So it's difficult to be prescriptive for one person. All I'm just saying is everyone's doing their best and have the conversation.
Thank you, Dr. Ayo. And somebody agreed with your presentation around sleep and said they would make some changes in their lifestyle of not doing all those paperwork by 1 a.m. in the morning. Right, our next question comes, it says here, Dr. Ayo, thank you so much for this presentation. It was well delivered and interesting, but it appears that wherever Black people are in the world, we have high blood pressure in higher numbers than white people, which is what you said. And they want to know why we have such high risk. Is it genetic? Even pre-eclampsia, we get more than others. You've mentioned this in the presentation, but just in case, can you touch on
so I mean, again, it's so great that Khan has this opportunity for you to look back at this on YouTube. But essentially, genetically, yes, we are predisposed because one of the factors in terms of salt, even if we ate the same meals, our bodies retain salt in a way that is at a higher percentage than other people. So these things contribute. And then maybe the things that we're eating, you have to have all that seasoning and stuff in it. These things are contributing to it. So yes, 100% genetically, our bodies are different.
Okay. Thank you for that. Someone's mentioned about OSA. I think this might be one that we'll take away with the CAN group because someone's saying there's a need to educate our people on it. And I absolutely agree with that because they also say there's something about hypopnea having an effect on high blood pressure. The other one is about high cholesterol. Is high cholesterol linked to high blood pressure?
So yes and no, in that high cholesterol doesn't per se cause high blood pressure, but it tends to be running alongside. So so the ultimate thing we're worried about is what we call cardiovascular risk. So that's the risk of damage to the blood vessels that are in your body, and the knock-on effect is a problem in the organ that the blood vessel is supplying. So you can have cardiovascular risk that affects your heart attack, heart failure, that affects your kidneys, chronic kidney disease, kidney failure, that affects your brain, dementia, stroke, all these kinds of stuff. So, but it's essentially damage to your blood vessels over time. The issue is that people who tend to have high blood pressure and have these problems tend to also have high cholesterol, and they're both risk factors for the end cardiovascular problem. So high cholesterol doesn't cause, but it's a double whammy in terms of risk of cardiovascular risk.
Absolutely, thank you for that. The other question we have, it says, should we be encouraging people who are not diagnosed to get a free blood pressure check at the pharmacy, as many people are walking around undiagnosed? And I agree with that.
So 100% a resounding yes. So one of the things that we're noticing, and I'm sure Dr. Onyi will attest, is that we are noticing people are getting diagnosed with high blood pressure younger and younger. So there was a time when it was like, oh, if you're in your 30s or over 30 or over 40, you have a family history, get checked. I would say, if you have a family history, if you get in your 20s, start checking. Now you don't want to be obsessed by it. No, don't check it every 4 times a day. No, because that can become a self-fulfilling prophecy in terms of stress and things like that. But so if you don't have high blood pressure and it's been check it every 6 months, every year, fine. But if you notice that it's an issue, If you have a diagnosis, you should be checking at least weekly to make sure that you're doing stuff. And if you're worried about it over a period of time, if you're going to see your GP, check every day and then go and see your GP. Well, absolutely, one of the things that Khan does with community outreach and stuff in the pharmacy, what we're trying to do is lower the bar. You don't have to go to see a GP. So that you can lower the bar, buy your own, or there are some phones now that can give you a rough estimate of, and the technology is improving all the time, so it's actually more accurate than you might think. So yes, absolutely, go and check. But I would just say don't become obsessed by it.
Okay, just to make a plug, if you're over 40, once you get to your 40th birthday, as a GP, I will send you a letter to say, could you come and get your health check done? That is your free MOT from the NHS, and you come to see us every 5 years. So if you're not taking advantage of it and you're in the UK, I would say, please do that. If you're younger and you have a family history, the pharmacies will be more than happy to check your blood pressure. Don't forget, you don't have to come to your GP to do that. You can go to a pharmacy, they'll be able to do it for you. And like I said, if you can afford it, just buy a machine. It doesn't cost as much as you think. Okay, thank you very much.
Probably spend more going to the cinema.
Absolutely, absolutely. Someone asked a question about the range of high blood pressure, but I don't think we're going to go into that because if the person watches the presentation, you did give us a good range. There's a last one I would really love you to answer. It talks about the blood pressure medication. It says, it's been depleting my potassium. What next? I am now increasing my potassium and reducing my tablets or changing, but to what?
Okay. So I suppose you may be talking about some sort of diuretic therapy. So there are lots of most of the diuretics that we use also deplete potassium. Now, when you say deplete, there is the theory and there's the actual. So although medication cause you to have low potassium, what we would need to know is on a blood test, is your potassium low? Because if it's not low, then there's no issue. And if it is low, then there's a conversation to have with your GP about, okay, so how do I manage that in terms of, do I need to, think about lifestyle changes in terms of diet? And there are some additions to blood pressure medications that are called potassium sparing. So for instance, let's say I have a diuretic therapy and my blood pressure is not controlled, but my potassium is low, then would I be eligible for this other medication, which might lower my blood pressure but increase my potassium? So there's lots of things to do, but there's a difference between the theoretical risk of my blood pressure being low and the actuality of when I test it with the blood.
Okay, sadly, we have some other questions coming in, and I don't know how you feel about answering a few more.
I'm happy to answer a few more. It's probably my fault for waffling on before.
That's absolutely fine.
Sorry.
This one is more on our diet, so I'm going to group them together. Okay, someone's asking about protein-heavy diet and blood pressure. Another person is asking about herbal remedies like hibiscus and garlic. Do they work? And there is something about not having enough potassium. Can you explain that? And then someone's trying to tie all that to mixed race people and medication specificity. Do we assume or focus treatment on this black side?
I understand. Okay, so in terms of, so for clarity, I am not a nutritionist or a dietitian. So these are just my thoughts about these questions. But there are places you can go to get information about this. So I would encourage you to, again, take responsibility and do that and make sure that you're checking reputable sources. For clarity, you don't have to have certification, qualification to post on YouTube. So just put that out there. Right, so in terms of, we've already talked about potassium, so yes, it needs to increase potassium in general. Specifically about the hibiscus and the whole remedies and stuff. So my view is back to the thing we talked about, all the things that can be a risk of high blood pressure. Probably, I think there's an emerging evidence. I know a dietitian who was even doing some study on some of the benefits of West African diet as it comes to health, because some of the stuff we call home foods, we may not have realized that there are some intrinsic health benefits from that. So there's research there, so you have a look. I don't know specifically about hibiscus and garlic. Now, what I know is that they're probably not going to do you any harm, but I would say, just, well, why don't you try? You know, so if you're in a position where you can try some garlic or hibiscus tea or whatever, and you can measure your blood pressure, and over time you notice that continuing taking it reduces, great. Let's do that. So again, I don't know the data behind it. Why don't you try? The other thing is that this might be controversial, but I'm happy to pay for placebo. I believe that there is a mind-body connection, and as long as the thing I'm doing isn't harming me. So no, I'm not going to do things that harm me. But these things, my belief, again, God's original idea, there's a phrase in the Bible that said that God gave these fruit for their health. So I believe that God's plan was to make things available to us from a lifestyle point of view that are freely available in the earth, that we can consume, so that we can say these things help me stay healthy. Because again, modern medicine is best for an emergency. And you have to understand how we get data. The way that I know that paracetamol works is somebody paid millions of pounds to test paracetamol against what we call placebo, which is essentially nothing. And we now know that it works. Every drug that you are prescribed, someone has paid millions of pounds to test that. Now, the question we have to answer is, there are things that work, but who's going to pay £1 million to find out whether garlic works better than Ramipillo? And no one's going to pay for that, because there's no money in it. And we have to acknowledge that this is the world that we live in. The thing that moves the needle often is bottom line money. So try it. As long as it's not harming in terms of health stuff, let's try it. But again, just make sure you have the conversation with your GP. In terms of mixed race, again, I don't know the data in terms of the level of blackness, if you will, that contributes to different medications. So in short, I don't know.
Thank you, Dr. Ayo. And I think I'm going to take this very last one, and then we're going to hand over to Sam. Someone's talking about alcohol. Should we take alcohol at all, and what percentage? So I'm going to say to you, know your units. Yeah. Okay. As a GP, I would say to you, please do not drink more than 14 units in a week, and make sure that you space them out and have days when you do not drink. The less you drink, the better. And with that, I am going to say thank you, Dr. Ayo. That, as always, very educative, and we really enjoyed listening to. Oh my goodness, somebody's put another one I've been asked to ask you. You talked about taking amlodipine, and someone's come back to ask you a question about it. Someone's worried that they've heard it affects the kidneys. Someone else is worried that it causes gum disease, and they've had to go and have a deep clean. Do you have any suggestions?
So I'm not aware of any data to suggest that amlodipine causes kidney disease. Although other higher blood pressure medications directly affect the kidneys, but calcium channel blockers don't do that. The most common side effect is swelling to the left. For full transparency, I am taking amlodipine. So I'm not aware of an effect on kidney specifically, and of the ones that are less infected in Black people, amlodipine isn't in that count. So I would be wary of that advice. I've not heard anything that would support that. And specifically the dental hygiene, I've never heard of that. I don't know whether that's one you have you heard that?
No, I would echo that. It could cause, but it's not as common. It can cause, I think it's dental hyperplasia.
Hyperplasia, not disease.
Yeah, not disease. So I am not sure about that one. But like I said, listen, if you're concerned about it, I am a GP. I am always very happy to have a conversation with my patients. And remember, in England, especially in the UK, we tend to discuss and agree so that when you're taking the medication, you have informed consent. My job as your GP is to give you all the information, have a conversation with you, and then you make an informed choice. So please, before you stop taking your medication, go and have a conversation with your GP, who is more than happy to have a conversation with you. And with that, I am going to say Thank you so much, Dr. Ayo, for that wonderful presentation. And I'm going to hand over to Sam. And thank you, Can, as well, for giving us this amazing platform to have some of these conversations that we would not be having ordinarily. And if you take away nothing from this conversation today, buy a high blood pressure machine and know your numbers. Thank you, everyone. Over to you, Sam.
Hello, everyone. Thank you very much for joining us today. Thank you very much, Dr. Ayo and Dr. Onyi, for another fantastic session. I'm just going to quickly go through what's happening here at Khan, if you just bear with me. Just so you can all see me. Perfect. So, as I said before, thank you to the doctors. I think today's been very, very informative. Lots of lovely questions and providing us some deep insights into how we can, navigate these health issues that could arise. And as Dr. Ayo said, medication is there to help, but it's good to prevent it by, being proactive and working on yourself before you get to the point where you need some medication. So we'll be back here next week, Saturday, I almost said Thursday, next week, Saturday, at the same time, same place, discussing a different health topic. So look out for more information on socials for that. If you want to share the link with your friends and family and network, we do deeply appreciate that. And we do want everyone to, learn about their health and live longer. Let's move this out the way. So on the 11th of July at 10 p.m. in London, 𝗱cie𝘄H6LD, we'll be taking part in an event called 3% and Count, a community gathering event where we help educate the community about the importance of taking part in genetic research. As you know, well, as you may not know, barely 3% of genetic research reflects people of African heritage. So when medications come out or when new things to help people live longer, new things to help people, stay healthier comes out into the public, we are not counted as much because we're barely represented in the research or in the trials that take place. So it's important for us to come down to this event, support, take part, and there's going to be stalls, local businesses, conversations about, what it means to take part in research. We know as a population that, sometimes we've trusted the system too well and they've done us wrong, done us dirty, but we're trying to repair that and improve the lives of our community. So that's why we're taking part in this event, and we'll love to see every single one of you there who can make it. If you're not available, do send it to your friends and family and get them to come down if they're based in the area or in the general London vicinity. If you are in need of some counseling, we do have a Black-led counseling service provided by professionals within our community who've been doing this for a long time. They're available for areas in bereavement, grief and loss, mental health, family support, domestic violence, substance abuse, and gambling issues or gambling misuse. That's the right terminology. Marriage and family issues, we are able to provide that within our counseling service. And if you just need some general counseling, please do reach out to us at counseling@kaan.org.uk. This is a free service, and you can just email us and get in contact with someone from our team. Thank you. We are quite passionate about joining the mission to eradicate new HIV cases by 2030. So we are trying to ensure that people get tested as frequently and regularly as possible. HIV can seem like a taboo in our community, but we do know that people can live long, healthy lives, even if they have been diagnosed with HIV, with lots of different medications out there to help them sustain a normal standard of living. So if you are interested in learning more about the Red Ribbon Champions, the Black Red Ribbon Champions, please reach out at BLK Red Ribbon at @kaan.org.uk. If you do need any support, we do have a support service as well with the advocacy team where they help you support, give you some information and, help safeguard you from things like domestic violence, sexual abuse. And there's a sexual abuse service there where you can get some more information on how to, go about certain situations that you have found yourself in, and we are there to support you as a community. We do have an advocacy service and home office service, a family advocacy session, and legal drop-ins. If you have any questions that in regards to your, employment or your visa status or whatever you need in terms of legal advice, feel free to drop in. If you need some more information, please contact advocacy@𝗀𝗉𝗄.org.uk. Lastly, we have an 𝗱ncill Black Community Health Forum, where we get communities to come together and talk about various things that could help shape experiences, help people speak up, improve local health services, and just improve the general health of those living in 𝗱ncill. We do know that this is a very selected area in London, but we do encourage those that know anyone in the 𝗱ncill area to reach out to us at 𝗱ncill@𝗀𝗉𝗄.org.uk. We'd love to hear from you. Just want to say a big, massive thank you to all of you that have tuned in again this week. If it's your first time or if it's your second time, we do deeply appreciate it. If it's your, 100th time, we do appreciate every single time you tune in with us on Saturday. It's quite important that we are all here to learn and improve our health. So look forward to seeing you all next week. And thank you for your time. Feel free to share the Zoom link with your network for next week and the YouTube link, which will be posted on socials. If you need it, just contact someone from Khan and they'll be able to share it with you.
Our time for today. Whether you join us on Zoom, Facebook, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.